The only practising medical doctor in the House of Representatives says politicians are being pushed to the brink. The Liberal backbencher Dr Mal Washer says the tight numbers in the new parliament have led to longer sitting hours, and he says the pressure on being constantly on call could lead to substance abuse and other health problems.
At the end of another gruelling parliamentary sitting week, federal politicians can't get out of the building fast enough.
Good to get home.
Particularly good given the new hung parliament and minority government has also brought with it extended hours and stress.
Well, they take their toll on you by the end of the week.
Now, the only practising GP serving in the House of Representatives has decided to speak out. Liberal MP Dr Mal Washer warns the longest sitting hours are harming Parliament's productivity and putting politicians' health in danger.
Again, we're going back to the bad days, when we were working at crazy hours, and then when people tend to use more drugs like wine or alcohol, illicit drugs, of course.
And the long-serving backbencher says he's already made some alarming diagnoses.
People walking around with lots of respiratory problems because their immune systems are being compromised with this. They're fatigued, not as sharp as they would normally be, and so we're creating, to some level, slight dysfunctionality in our politicians.
But there's a dilemma for politicians. Complaining about hours and conditions will never go down well. Even so, senior figures from both sides of the House acknowledge the extra workload is testing them. So what's the prescription? More pay, fewer hours and shorter speeches.
We get a better parliament if we make it shorter and more succinct.
Those remedies are already winning support.
It's having time to exercise in this work environment is extremely difficult.
With just 2 more sitting weeks remaining this year, they'll have plenty of time over the Christmas break to think about a more healthy lifestyle. Andrew Green, ABC News, Canberra.